thing we're gonna do is posture observation, see where the head is in relationship to the neck, right? Whether she has forward head posture, whether she's in extension, flexion, side bending, rotation, that's all gonna affect mouth opening, okay? So I'm gonna go ahead and ask you to look forward, okay? And so we can look at observation. Does she have a facial scoliosis or is it all symmetrical? Meaning, is the forehead in line with the bridge of the nose, in line with the center of the mandible, okay, as she's sitting there. So she's pretty aligned, right? Okay, so look forward. Look forward.
She has a fake eye.
Okay, so next thing we want you to do is I want you to go ahead and open your mouth as wide as you can for me.
Oh.
Yep.
Do you want to close it or no?
Yep, open and close. And
Ooh.
open,
Oh, nice.
open,
Little
and
snap.
close.
Snap.
Okay? So you guys see the,
Yeah.
on the mouth closing, you see the S deviation. Okay?
Yeah, on the way up.
So you,
Oh yeah.
so don't make your patient move, you move for the patient, okay? So when we want to see how much mouth opening, we're gonna put this on the bottom of the tooth here, okay?
Max open.
Open as far as you can.
Impressive.
You can't say that. You can't say that.
Yes, I can. So she's got about 55 degrees. So that first part of our education is going to be about mouth opening and avoiding excessive mouth opening. So this might be an opportunity where I might say, okay, so chew your knuckles just like this, and then open your mouth, and that's as wide as I want you to open. Okay?
Oh no.
So I just use that quick education.
I can get like 3 or 4.
Lessen the gate.
That's what's got five.
So then lateral excursion. So we'll go ahead. So the first thing he did was, palpate the joint and then put your thumbs here and open your mouth slightly. Okay, and then move your jaw to the left. There you go. And back to the center, and then to the right.
So what are you doing right now, doctor?
I'm just observing lateral excursion, left and right, and back to the center.
Via
Right?
The way you see over
the pads of your pointer.
So they're just on the joint.
On the joint.
itself. Yep.
Right in front of the ear.
Okay. And then back to the center, and then to the right.
Hops.
And then the right.
Oh, he's trying to see which day last week.
Does that hurt?
So it's really not. It's not really a pop. It's not like going. It's
No.
just-
It's just like
Yeah.
I feel it like kick and then like.
yeah.
Is this
It's not like a clack,
Yeah.
a typical click you see. It's kind of like
It looks like a roll.
it kind of. It's not kind of like hesitant,
Yeah.
right? It gets over there and then goes. Okay.
So resistance.
So mouth open or lateral excursion. Remember this one? Okay. So we want to line it up with the top teeth, right?
strong eyebrows?
And then we see how far she can move to the left. Okay, so that's about 8, and then back to the center, and then to the right. And that's about 10. Right there. Okay, so she's got more to the right than she
Here
was
we
to
go.
the
10.
left. Okay? So that's active movement. Can you hold your instrument,
sure,
please?
sure.
Okay. Right. So go ahead and so open your mouth all the way. So I'm not going to go ahead and do any overpressure here because that's enough mouth opening, right? And we don't want to strain any of the ligaments in there. Close. Okay, and then move your jaw to the right. Okay, I'm going to take it a little further. Any pain with that? Okay, and then back to the center, and then move to the right or left, your other right.
P-ROM.
And this one has a much firmer end feel than the other side. Okay, so go ahead to the right again. Okay. She has a little give there. Do you feel that?
Mm-hmm.
Then go to the left. So she's got a really firm, abnormal capsular end feel here. There's no.
It's not going anywhere.
It's not going anyplace. And she feels that. It's like
Yeah.
abrupt. Okay. Cool. Okay. Then we can do protrusion because we haven't looked at protrusion yet. So mouth slightly open, just a little bit. And I want you to move your bottom teeth forward. Okay. So normal protrusion is.
No stickers.
Okay, so relax, try that again. So you can do overpressure. I very rarely do overpressure with protrusion or retrusion, but you can, because it's uncomfortable here where you're trying to do the overpressure. And then bring your jaw back this way. There you go, straight back. So I can do a little retrusion there. Just give a little overpressure. Any pain with that?
Not when you were doing it, but like when it returned.
Return.
Yeah.
So rebound, little rebound
Yeah.
stretch. Okay, so maybe a little pressure in that posterior compartment. You see that? So when she did retrusion, pull your jaw back. Now I'm going to give you a little overpressure. Relax.
Dr. Nally, can
And
you
coming up
demonstrate
for
the hand placement of protrusion again?
So protrusion would be just
Hooking the mandible.
yeah, behind the mandible.
Mm-hmm.
I just give it overpressure. That's why I don't do it too often because it's really tender back here. So put your hands in this space
Wow, that's tender.
and try to pull forward on it. It's just tender to do it. Okay? But you can do it. Okay? So I want you to go through active and passive motion. I want you to measure mouth opening and then lateral excursion right, lateral excursion left. And then we'll move on to resisted testing and then mobility testing, right? But since you guys haven't handled these tools, let's do that first.
Okay.
Okay? That's yours.
Oh, yeah.